Good afternoon, everybody. I'm absolutely delighted to welcome you all to the launch of this joint inspection report on the effectiveness of diverting children from the criminal justice system, meeting needs, ensuring safety and preventing reoffending. As Chief Inspector of Probation, it's my role to scrutinise the work of probation and youth justice services to highlight what is working well and what may need to improve. We also work with other inspectorates to shine a light on how the overall system is working. So I'm delighted to be joined by Michelle and other colleagues who've led this inspection from HMICFRS. There has been a remarkable and sustained success in recent years in driving down the number of children in custody, the number of first-time entrants into the justice system. In a CJS which is under huge pressure, it is perhaps a beacon of hope. Much of that success has been driven through close partnership working and seeking to intervene and divert early, and use of out-of-court disposals where appropriate. This excellent report highlights that there is more to do to ensure that out-of-court disposals are used appropriately and consistently and give the children the support that they need. At present, we observed a postcode lottery and room for better join-up between police and youth justice services to ensure that the needs and challenges faced by vulnerable children are properly understood. Our team will talk you through the findings of our inspection and provide an opportunity for discussion. I'm now going to pass over to Michelle to present this on behalf of HMICFRS, and then we'll pass to the direct inspection team. Michelle.
Thanks, Martin. So thanks everyone for coming today, and it's great to see such a big turnout. And as Martin mentioned, I'm HMI Michelle Skier from the Policing and Fire Inspectorate, and it is lovely to see how many are online to hear about our findings. From the inspection, as Martin said, it's clear that the criminal justice system has sort of not kept pace with the changes to the use of out-of-court disposals. It was disappointing to find that the current system, including the policing practice, is at times fragmented and inconsistent. It's really important that police, youth justice services and other partners work together to make sure out-of-court disposals are used fairly and consistently right across the country. And the recommendations that you will see today that we will go through in this report should make a real difference to improve outcomes for children and help communities to be safe, which is what we're all here for. Thank you.
Thank you, Michelle. I'll just pick up now, get the next slide, Holly, please, and talk about the methodology for the inspection. So the inspection team was made up, I was leading myself for HMI Probation, along with my colleague Ian Elliott for HMICFRS. And on each fieldwork week, we had 5 inspectors from HMI Probation and we had 3 inspectors from HMICFRS. We were also joined by a lived experience consultant from Use a Voice, who was working on our behalf to consult with children to get their feedback and perspective on the services that they'd received. The fieldwork for the inspection took place between January and March this year, and we visited 8 youth justice services across 6 police force areas. HMI Probation inspected a total of 98 cases, 88 of those involved children who'd received a youth community resolution or an outcome 22, and 10 involved other types of disposals. We also, alongside, assessed the quality of decision making in an additional 66 cases where children received a youth caution or a youth conditional caution. And we made some comparisons between the work delivered under outcome 22 and community resolutions, and we found the differences to be negligible. HMICFRS inspected the quality of disposal decisions that were made by the police, and the police outcome recording codes that were focused on were outcome 8, which is community resolution, outcome 20, which means another body or agency will deliver some work to the child and the victim will be informed of that. Outcome 22, where they could be outcome 21, where it's possible to proceed to charge, there's enough evidence to do so, but it's deemed not to be in the public interest. And outcome 22, where diversionary or educational intervention has been delivered to the child and it's not considered in the public interest for any further formal action to be taken. We held a range of meetings and focus groups with staff delivering out-of-court disposals with their managers and senior leaders at both national and local levels. and a report from User Voice will be published alongside this report that we've published, and that will incorporate the feedback, and we've incorporated their feedback into our key findings using quotations, including quotations that were gathered from the 50 children that they met with and who helped to inform this report. Can we get the next slide, please, Holly? So in terms of governance and leadership, it was clear to us that there was a commitment to child-centred justice. The increased use of out-of-court disposals reflected a broader shift towards a more child-centred, welfare-oriented approach to youth justice. There is a national commitment to divert children from formal court proceedings where appropriate. This position was unanimously supported by the national leaders that we consulted with during this inspection. Every Youth Justice Partnership Board had a clear vision for children based primarily on child first principles, with a strong focus on diversion and early intervention. The Home Office and the Ministry of Justice have allowed local police forces flexibility within out-of-court disposal guidance in order that they can tailor responses to local community needs. But what we found was that whilst there was a national and local commitment to child-centred justice, the overall approach was fragmented and was hindered by inadequate strategic direction. We found widespread agreement amongst government departments and stakeholders on the need for a clearer, more coordinated national approach. One quote that highlights this and aligns with our findings was that one national leader told us that there's no obvious national policy driving the use of out-of-court disposals. They described it more as a grassroots approach in policing, particularly in the use of Outcome 22, stating that there's no national framework, no structure, and there's no accountability, no monitoring, and very little data to support the overall approach. Unlike statutory interventions monitored by the Youth Justice Board, there was no clear picture of the outcomes for the children receiving out-of-court disposals. There was no effective way to examine or track the specific use of the out-of-court disposals at a national level. And there was some confusion about the significance of various police recording outcome types used to close crimes, and a perception that was some of these were more likely to lead to harsher consequences for children in the future in terms of disclosure of their offending. So there was a need for consistency and fairness, where the Home Office and the Ministry of Justice have allowed police forces flexibility. Unfortunately, this has resulted in significant variation and limited standardisation across regions. The inconsistency of approaches between areas and a lack of statutory framework for some out-of-court disposals has resulted in what could be described as a postcode lottery in decision-making. And this raises concerns about fairness, both in terms of who receives an out-of-court disposal and the support that they receive when they do. Magistrates raised concerns about inconsistent use of out-of-court disposals within and across police force areas. Given the inconsistency in practices surrounding the delivery of out-of-court disposals, we believe that consideration should be given to developing a new revised statutory out-of-court disposal framework. Next slide, please, Holly. Sorry. So the commitment to child-centred justice. Local Youth Justice Partnership Boards didn't have a clear understanding of the overall volume of out-of-court disposals or the effectiveness of the interventions involving youth justice services and other partners. There was limited data on out-of-court disposals, and this made it difficult for some stakeholders to always fully support the approach. It raised concerns about whether the focus remained on children's best interests or had shifted towards easing system pressure. In well-functioning boards, partners work together to identify gaps in understanding the profile of children receiving out-of-court disposals and the barriers to their effective use. However, the shorter time frame for out-of-court disposals risks shifting the focus from what a child's needs were to what could be achieved within the time limits, and there was not a good understanding of this dynamic. Boards lacked an understanding of out-of-court disposal numbers in their area, particularly when the YJS had not been involved with the child. The first-time entrance key performance indicator was not a reliable indicator of reduced offending and improved outcomes for children. Boards often lacked a full understanding of out-of-court disposal children's backgrounds and offending histories. Reoffending data was sometimes analysed but not often reliable, or it was lacking in detail. And there was limited analysis of specific cohorts of children from Black and minority ethnic backgrounds, for instance, and for girls as well. There was a fragmented approach. Turnaround funding was generally used effectively, but the short-term and uncertain nature of some of the funding streams made it difficult for services to develop long-term strategies. Funding arrangements varied significantly across the services inspected. All reported that short-term and late allocated funding posed significant barriers to long-term planning. Some services struggled to meet rising demand, particularly as out-of-court disposal use grew and children required more intensive support. And one quote that we heard was that there'd been no change in YJS resourcing or funding in the past 10 years. This raises the potential for a disconnect between national expectations of service delivery and what is realistically achievable. Managers built effective local partnership relationships and actively advocated for children consistently. And most staff reported receiving appropriate training and spoke positively about their managers. Some boards were well established and cohesive and worked together to identify gaps in understanding and to address the barriers. However, local partnerships still need to develop well-functioning pathways into both mainstream and specialist services, and all staff need to fully understand the complexity of their roles, particularly around keeping children in the community safe. Next slide.
So this bit is over to me. And I'm going to illustrate some of the bullet points by showing or telling you about some facts and figures I've pulled out of the report. So just in relation to the first bullet point, we reviewed 87 community resolution cases. We found that 41 of the children had previously offended. And of these 41 children, 27 had 3 or more crimes attributed to them. And when we look back at these previous cases, we were concerned that none of these previous cases had actually been referred to the Youth Justice Service in line with the guidance. Out of the 87 cases we looked at, we found the Youth Justice Service had only been informed in 34 of them. None of the forces we inspected had an automated system for notifying the Youth Justice Service, as recommended in the NPCC Community Resolution Guidance. None of the outcome 20 or 21 cases have been subject to a joint decision, despite the worrying nature of some of these offences. And if you read the report, we've illustrated some of them as case examples. Outcome 22 cases were much more likely to be subject to joint decision making, which is more positive. And in relation to the second bullet point, this is mainly about community resolutions. The NPCC Community Resolution Guidance makes it clear that community resolutions are non-statutory. The interventions agreed cannot be legally enforced or escalated to a higher disposal. But we were concerned to find that 3 of the 6 forces we inspected had community resolution forms that contained warnings about the implications of not completing the agreed actions. One form asked the child to accept that failing to complete the agreed actions would result in legal action being taken against them. So this practice may at best be misleading, but it contradicts the voluntary nature of the actions and implied that legal action could be taken for failure to complete the interventions, rather than prosecute for the original offence. And while not strictly related to the bullet point, we also found there was a great deal of confusion and inconsistencies between forces about the difference between admission of guilt and acceptance of responsibility, and which one of them was required for a community resolution. In relation to the use of the gravity matrix, in the 179 police-only decisions we looked at as part of the inspection, there was evidence that the gravity matrix had only been used in 35 of them. The gravity matrix lists crimes and their starting point on the matrix. For the outcome 20 and 21 cases, the gravity matrix wasn't used in any of them. This was despite the fact that some of the cases involved quite serious crimes, and I'll tell you a bit more about the crimes bit later. The gravity matrix guidance says that the score can only be moved 1 point on the scale. We found that the score was never moved up. But when it was moved down, it sometimes moved more than 1 point. This may have been appropriate, but sometimes we just couldn't see the rationale for it. We think the police need to have greater oversight of these decisions, which is why we made a recommendation about it. Next slide, please, Holly. So in relation to the first bullet point, we found there was a great deal of inconsistency about what was meant by outcome 22. For instance, it was used in 4 different scenarios. Firstly, where there was insufficient evidence, but to proceed with an out-of-court disposal, but there was a decision that a child would benefit from interventions. The next scenario would be where there was sufficient evidence to proceed, but a decision had been made to give an outcome 22 rather than a different type of outcome. Then there were deferred caution schemes, and then there was deferred prosecution schemes. So they were all in outcome 22. It was really difficult for us, the police, and in fact anyone involved in the criminal justice system, to work out what was going on and how effective each of these approaches were. Unlike some outcomes, outcome 22s are currently not seen as a positive outcome by the Home Office or the police. So this was a barrier to their use in some places, and we've made a recommendation about this as well. Just to be clear, we're not advocating that all of the 4 outcomes I've described in the outcome 22s should be seen as positive. We think this should really only happen where there is evidence that the child has committed the offence, an indication that the victim has been consulted, a rationale about how the public interest is served by using that particular outcome, and a rationale for why it's in the best interest of the child, and a rationale for how the interventions would prevent the child offending. We think that's the best framework for the use of outcome 22s. In relation to the second bullet point, just to give you some idea of the nature of some of the offences we found that have been closed with outcome 20 and 21, we ask each of the inspected forces to tell us about those crimes that had happened in the year before. In relation to outcome 20s, 42% of them were violence offences, and there were hundreds of these offences, by the way. 42% were violence offences, 30% were sexual offences, and 23% were sexual imagery offences. And in relation to the outcome 21 offences, again, there was high proportions of sexual imagery offences, 51%, violence offences, 18%, sexual offences, 14%. So, as I've said above, on a micro level, none of the crimes we examined were the subject of joint decision or the child gravity matrix, which is obviously a worry. But on macro level, none of the forces we visited had an understanding of these crime outcome types and how they were being applied, particularly to children, and the types of offences that were being used, the outcome code was being used for. Next slide, please, Holly. So the title of the slide is joint decision making. It's a little bit of a misnomer because responsibility for determining disposal outcomes ultimately rests with the police. So what we mean by joint decision making is multi-agency collaboration. We think this produces the best decisions and is the best way to meet children's needs and divert them from the criminal justice system. In relation to the first bullet point, we found that when collaboration was undertaken well, we saw positive outcomes and effective practice. All the services we inspected had a joint working policy in place, outlining the decision-making process and the roles and responsibilities involved, though of course there were differences between them. But there was no single model that was completely reliable in ensuring the most appropriate disposal. Overall, and based on the information recorded in the case files and the evidence provided, we agreed with the disposal decision in just under 2/3 of cases. And this varied between forces, as you can imagine. For instance, in Walsall, we agreed with the disposal decision in 3/4 of cases. In Dorset, a different model where no multi-agency panel was in place, we agreed in a similar number of cases. In that case, in the case of Dorset, the out-of-court disposal interventions delivered to children still involved appropriate input from partner agencies. So this suggested to us that both models could be effective when implemented well, but the common denominator was strong multi-agency working. There were inconsistencies between how the panels operated and their composition. We found multi-agency decision-making panels were common and were supported by good information sharing, but we did find the inconsistencies. For example, significant variation in the composition size, variance in seniority, particularly from the police. Early help frequently attended, but there were notable gaps in attendance from children's social care, and it was rare to see representatives from the child's school or educational placement. Some panels use a voting system, where all members voted on the disposal outcome. We're concerned about this approach, particularly the lack of clear accountability. Because although disposal decisions ultimately rest with the police, in some cases the police representative was outvoted without escalation to a more senior police officer, and we've made a recommendation about this. The use of voting, though, raised further issues, as some panel members lacked training on out-of-court disposals and did not fully understand the differences between the disposal types they were actually voting for. We found there were sometimes tensions about the decisions between the police and partners, particularly for more serious offences such as those involved in knife crimes. Lastly, the final bullet point, where the information provided to support decision making fell short of our expectations, it was often because it lacked depth and analysis. In some cases, this led to missed safeguarding concerns and risk factors and assessments that failed to accurately reflect the child's circumstances. In some areas, poor record keeping made it difficult for us to assess the rationales for decision making. For example, in some areas, poor recording made it difficult to assess how the gravity matrix had been applied. In almost every case, Youth Justice Services completed their assessments before final decisions were made, which was positive. We found that children and the parents or carers were often actively involved in the assessment process, giving their perspectives of the offence and its underlying causes. We found that Youth Justice Service police officers reviewed police systems and records and shared information, but practices sometimes varied about what was shared. In our fieldwork sample of 164 children, we identified 62 children who had received at least one previous out-of-court disposal prior to the one subject to the decision we examined. But the history was not always known to the Youth Justice Service, shared with decision makers or recorded in minuted meetings. We recognise that the youth justice response is not necessarily needed for all children, when this may be for a low-level offence involving a child who has not come to attention before. For example, when a child's welfare needs can be addressed more appropriately by other agencies already involved through existing support. But we think there should be a multi-agency decision about this, and that will result in the best outcomes for children, and the rationale should be properly recorded. And that's the end of my input. Over back to you.
Thank you. Yeah. So after decision making and diverting a child from the justice system, the real question is, or main question is, are they getting the help and the support that they need to truly divert them from coming back into the criminal justice system? And what we found was that there was a high level of unmet support needs for children. Access to education and interventions for emotional health and well-being often remained unmet at the end of the out-of-court disposal. Support either arrived too late or it ended too early, and it lacked the sufficient exit planning and forward planning to sustain the support that the children needed. So this meant that children on the edge of the criminal justice system remained at a significant risk of further escalation, as these issues had been identified to the reasons that they were had gotten into trouble in the first place. In terms of education, a significant number of children were either not receiving their legal entitlement to education, or they weren't in a suitable provision to meet their needs, and often they had high levels of needs. Almost a quarter of them had an education, health and care plan. Engagement between the Youth Justice Service and education providers was often limited. This meant that discussions about the child's progress, behaviour and support needs, particularly where there was a risk of placement breakdown, were often missed, and opportunities to put additional intervention and support around them to sustain those placements weren't harnessed. We were told that some children remained involved with the YJS longer than necessary because their educational needs had not been addressed during the disposal period, which on the one hand is positive, but on the other hand sort of goes against the principles of the out-of-court disposal approach, which is about making sure children are engaged in the mainstream services that they need to move them on. Health. CAMS are the equivalent, often children are the equivalent sort of mental health, emotional well-being support. children often chose not to take up that support, and the short length of the out-of-court disposal left limited opportunities for that to be revisited. And because it's voluntary and therapeutic, you need to be, you can't enforce this. You've got to support children to be able to access that. And building that trust to help them to do that, it takes time. And because the out-of-court interventions are often very short, sometimes only 4 sessions maybe, it doesn't provide the opportunity for that. So those children who hadn't been able to access that support, who came into the system with a high level of need that hadn't been identified, came to the end of their out-of-court disposal and they still hadn't had the support that they needed. Speech and language therapy and support was a notable strength in most of the services that we visited. It was a real focus. The need was for this type of intervention was well understood, but unfortunately access to that support isn't necessarily available in communities at the end of the intervention with the Youth Justice Service. So sometimes there's not enough time again for the impact of that to be felt. And the same with services to support neurodivergence. There's often, children were waiting before they came in to receive their out-of-court disposal, and there was still no further forward really at the end of their out-of-court disposal, which was problematic. In terms of victims, the importance of victim engagement, this needs to improve. To ensure the engagement process upholds the victims' code and amplify victims' voices. And this is particularly needed for child victims. And many of the victims in the cases that we looked at, the victims were children and they continued to be vulnerable, and we didn't feel that enough had been done to safeguard them effectively. Their age and maturity wasn't considered in any way differently than any other victim in many cases. All inspected services offered support to victims. Restorative justice practice was evident, and some areas really stood out for the high number of restorative meetings that they had between children and victims, and they offered powerful examples of the impact of this approach. However, many victims were not meaningfully involved, and barriers to their participation was neither routinely identified or addressed. There was little analysis of who engaged and at what stage, how satisfied they were, making it difficult to ensure compliance to the victims' code and to understand if there were certain groups of people that maybe were more reticent to engage in that victim work, to think about whether the services were well enough tailored to promote engagement from everybody. Additionally, although a significant number of victims in our sample were children, as I said, they weren't routinely considered as a separate and specific group with their own vulnerabilities. So inconsistent intervention delivery and a need for coordinated partnership approach was obvious to us. Interventions were not always jointly planned, delivered, reviewed or sustained. So although in many cases there was an initial joint decision-making panel with lots of different people from different agencies and services involved in that process, it wasn't sustained necessarily beyond that point and the input that they had at that time. So when services were available, referrals were not always made. Sometimes they were declined for unclear reasons, and there was limited analysis of referral patterns, engagement rates and completion rates and engagement rates with the actual interventions and ongoing support to be confident that the approach was effective. We saw effective joint planning in only 57% of cases, although the joint decision-making process provides an excellent opportunity for really strong planning to take place at that stage. We found that this wasn't routinely the case. Most of the children in our sample had current or past involvement with statutory social care services. However, social care services were rarely actively involved in the disposal decision making. It was a clear omission from most of the panels that we looked at, that even where children had an allocated social worker at the time, they weren't present for the disposal decision making and for the joint planning to take place. So as a result of that, the opportunities that were there to align the plans and deliver interventions that could support children and ongoing support were often missed. working often relied on individual staff going the extra mile as opposed to any sort of overarching approach that was established. In some cases, it was perceived that children's social care stepped back once the Youth Justice Service became involved, leading to case closures in some cases, and often a limited understanding of the short length of the out-of-court disposal, which was really disadvantaging for those children. All areas and provisions to support children, there was provision in place everywhere where there were concerns about harmful sexual behaviour. However, several children in our sample had such concerns, high levels of concerns, that were neither addressed with them or actually discussed with them during the period of their out-of-court disposal. So they didn't receive any intervention for that. And although links to child sexual exploitation multi-agency meetings were generally in place, they were not consistently utilised, usually because the exploitation needs of children had not been properly identified. Next slide, please, Holly. So in terms of education, services have processes in place to access education databases, this enabled them to check school records to see if children were on roll at schools and look at their attendance rates. And where education providers were actively involved in some of the cases that we saw, which wasn't routine, as we've already said, it added real value, significant value, because the people that see these children during the day, that they know them, they have lots of knowledge of them, were really able to inform the Youth Justice Service, and the Youth Justice Service was able to call on the support of the education provider. So a wraparound approach for those children really did make a difference. In some cases, the YJS worked with schools and children to identify a staff member who could act as a point of contact after the out-of-court disposal came to an end, which was very sensible and effective. And this was sometimes built into the exit plan to support the child's transition and promote stability and safety for them in their education placement. We observed strong advocacy from both Youth Justice Service staff and education staff in some cases for children with special educational needs, and this led to positive outcomes, often due to the persistence of individual Youth Justice Service workers, again, as opposed to any established effective cross-service working. It was really the tenacious approach of individual staff. In relation to children's services, in some cases, the YJS were able to incorporate early help services into exit plans, which was a strength, and this led to smoother and more effective transitions when this did happen. There were positive examples where roles and responsibilities between the YJS and social care were clearly defined and services were delivered in a coordinated way. Notably, were joint Section 47 child protection assessments and collaborative work on child exploitation took place. In one area, the exploitation team was co-located with the YJS. The team monitored statistics related to serious youth violence and exploitation, and staff could request an exploitation consultation. We identified this to be good practice because these consultations supported safety planning, mapping, and the disruption of exploitation. Positive examples, effective examples were offered to us there. In terms of health, access to substance misuse and mental health support was generally swift to access an initial meeting. Speech and language therapy was a notable strength, as I've already said, and there were well-established pathways in terms of speech and language, and we noticed some really good practice there. With the police, YJS staff generally had good relationships with the police officers embedded in the teams, and the officers were accessible, supportive, and they understood the child-centred approach. They were on board with it and supportive. So there was a really strong shared understanding across in respect of that. Okay, I'll hand the slides over now. Holly?
Yeah, thanks, Maria. So I'm going to share the headlines in terms of the quality of the youth justice casework that we found as part of the inspection. So thinking about the first bullet point, there is an opportunity to provide a greater focus beyond just the offence. There's a need for a greater emphasis on safety for others and the child. And this was evident in all aspects of the practice that we observed. And we saw that interventions tended to focus on the offence, and there was missed opportunities to really address and be curious about the other underlying needs, risks and safety concerns linked to a child's behaviour of concern. This also relates to the point previously that Maria raised about understanding victim concerns and safety. Overall, the children that we were inspected were highly vulnerable. A significant number of these children had experienced trauma and adverse childhood throughout their early years, but their experiences and impact had not been fully considered and fully understood throughout the assessment, intervention and delivery. There's an opportunity to consider wider contextual concerns. One good example of this is exploitation concerns were present in 42 of 96 of the cases. However, the addresses were not appropriately understood and acknowledged in the fieldwork that we saw in less than fewer than half the cases that we inspected. Notably, where children were assessed as posing a lower risk of concern to safety of others, the risk assessments and plans in place were more effective. Overall, our findings concluded that not enough is being done to fully understand or have a full understanding about how can we achieve the safety for others. There was a lack of ongoing reviews to ensure the safety of others. This was evident when children had committed further offending or further intel had been received. There's an opportunity here to address, review our assessments and intervention plans for children. One moment. So thinking about bullet point 2 and 3. So we had the privilege to interview, meet a range of fantastic, skilled and dedicated practitioners. Our inspection found that youth justice staff demonstrated strong skills in engagement, working alongside children and trying to understand their individual needs. Their support was highly valued from children, parents, carers and wider support. It was a real strength in the majority of the casework that we looked at, children's individual strengths, ambitions, interests, as well as protective factors were routinely interviewed. We identified and saw the use of creative activities, such as positive activities to build upon the pro-social identity of children. Home visits were conducted in nearly all of the casework that we looked at. This, in our opinion, allowed an insight into a child's daily life. We saw a strong emphasis on understanding and hearing the child's voice across all areas of services. We saw and heard how staff were able to form amazing relationships with children in short periods of time. Their ability to often apply trauma-informed and relational practices allowed them to build trusting relationships with children. So moving on to the last bullet point. We found the need for more inclusive approaches. Quite often, the individual and diverse needs of the children were not always met. Therefore, there is a need to provide more tailored and inclusive support. As I've already spoken about, a number of our children were highly vulnerable. A significant number had experienced discrimination and bullying. We saw an overrepresentation or a higher number of children receiving out-of-court disposals than what we had anticipated across in all areas. However, there was an inconsistent focus on the gendered factors that may have been influencing these girls' behaviours. As Maria's already mentioned, there was a strong evidence and identification of children's speech and language and communication needs. However, across most services, there was inconsistencies around understanding and exploring the neurodiversity needs of the children. Back over to Maria, thank you.
Thanks very much, Laura. So just sort of touching on the recommendations we've made, taking into consideration everything that we've just spoke about. We've made wide-ranging recommendations in this report across a number of national and local organisations, and they are the key themes on the slide that we have there in front of us. So I will touch on a few of those. I'm mindful of the time, want to leave time for questions, but we have recommended to the Home Office that they should amend crime outcome types to clearly distinguish between outcome 22, the different uses of it that Ian touched on earlier, and to consider whether deferred youth cautions and deferred prosecutions should be recognised as formal positive police outcomes. We know that there's a strong sentiment around that particular point in the sector as well from consultations that we've done. And we want to ensure that the Home Office can differentiate between out-of-court disposals issued to children and issued to adults. So that needs to be amended into the way that these things are recorded so that we can actually see the full profile of the use of out-of-court disposals for children. And we have recommended that the Ministry of Justice should work with the Home Office and the Youth Justice Board to review the relevance, suitability and effectiveness of the first time entrants key performance indicator and implement new reporting processes for all out of court disposals. And this also includes the tracking of outcome 20 and 21, particularly important given the points that Ian raised about the seriousness and of some of the offences that those codes have been used for and the frequency of their use. And we have also recommended that out of court disposals with all out-of-court disposals are considered in the overall reoffending statistics. It's appropriate given the volume of the use now of out-of-court disposals, so that we really understand whether this approach is actually delivering outcomes for children. The Home Office and the Ministry of Justice should remove youth cautions from the out-of-court disposal framework and explore the feasibility of introducing statutory deferred prosecution schemes and statutory provision for community resolutions. And the Home Office and the Youth Justice Board should evaluate data on outcomes delivered to children to understand the effectiveness overall. We've made other recommendations for the National Police Chief Council, the College of Policing, and for the Youth Justice Board and for Youth Justice Partnership Boards. All of the recommendations are in our report in full. So just in the interest of time for now, though, I think we'll hand over to User Voice because we'd really like to understand their perspective and the feedback we got from the children.
Thank you, Maria. Hi, good afternoon, everyone. So we are User Voice, and we are here to tell you about what children and young people told us about their experiences of out-of-court disposals. I'm Jenny. I'm the lead research manager at User Voice, and I'm here with my colleague Alex, who is our national delivery lead. I am going to hand over to Alex to explain a little bit more about User Voice if somebody doesn't know already. So can we have a next slide, please, Holly?
Thanks, Jenny. So at User Voice, our purpose is to change minds and transform lives. We do that by bringing together people who've been impacted by the justice system with those who deliver its services, creating a space for real transformative change. We believe justice should heal as much as it punishes, so that it creates safer communities for everyone. One thing that makes us really unique is that 80% of our staff have lived experience. So we've been there through courts, through prison, or on probation. It means we understand the challenges firsthand, and we use that experience to connect with others and help improve the system from within. So when myself and Jenny talk about this project, it's coming both from a professional and personal place, as many of our staff who worked on this project have walked alongside many of these young people, and we know what a difference it can make when their voices are truly heard. Next slide, please.
Thanks, Alex. So for this thematic inspection, our User Voice lived experience peer researchers, which Alex was one of them, they conducted 50 in-depth in-person interviews with children and young people. So before we look at the objectives. Alex, you want to explain with few words, how did you manage to get the children to talk to you? Because we don't know that's not probably the easiest job in the world.
Yeah, I mean, as you can imagine, speaking to young people can be challenging at times. And, you know, a lot of the young people we spoke to had come from really complex backgrounds and sometimes struggle to open up. But to help with that, we use different distraction techniques, things like playing board games, using fidget toys, shooting a bit of pool, or even using a VR headset. Those moments really helped us build trust and form genuine bonds with them. I remember one young person being really withdrawn when they first entered the room to speak to me. But as we played a few games and found a bit of common ground talking about PCs, he really opened up. And by the end of the session, he was asking when we were next going to be in. So yeah, I mean, that helped massively, as well as the fact that we spoke about our lived experience as well. And we saw the young people open up far more. As well as that, we looked at people's passports where possible. A lot of the young people had passports, which showed their interest, needs, and how we could approach each conversation in a way that made them feel more comfortable and respected.
Thanks, Alex. So for this consultation, our objective was to better understand children, young people's experience with OOCDs and whether it had met their needs. We also want to understand what support they have got and what they hadn't got. Then we wanted to know if they understood what the OOCD was. And then also we asked about their relationship with the youth justice workers. And finally, we wanted to get their perspectives, whether the OOCD will help with desistance. So that was kind of what we looked for. And now we go to the findings. So next slide, please, Holly. So I don't think it's a surprise to anyone here, probably, that most children and young people had faced significant adversities in their early life. They had poor school attendance, they've been excluded from schools, they have very unstable home environments, they had mental health challenges, and some had experiences of abuse. A massive number, 56% of the young people we spoke to were neurodivergent, and 42% said that they have suffered with their mental health. We selected a few quotes here. I'm not going to read them all. You're going to get the slides afterwards, plus our report is out, which is full of very insightful quotes from children. So I highly recommend you go and read them. But I'll just read the mid one, the young lady in the middle who told us that so much happens every day. And obviously, like I've already had like a court case because I went through sexual abuse as a child and things like that. So I just go through things every day. That's her reflecting how her life has been. Next slide, please, Holly.
So in terms of support received, 94% of the interviewed children and young people said that they had received the support they needed. However, fun activities were more common than tailored support. And some of the young people did express, however, they were getting the support with underlying issues such as mental health, substance misuse, anger management, and employment. And I'll read one quote here. She took us for ice cream and everything. I was loving my life. She took us on drives and everything. It was actually quite fun. And I think it makes people feel more comfortable as well. Next slide, please.
Thanks, Alex. So when we asked the young children and young people about their relationship with the youth justice workers, actually every single person told us that they had a good relationship, which is really great. They told us that the workers do not judge, they're very caring, and that they are very good listen. They listen to them. So which is sometimes was opposite what they experiences with the police, for example. There was one negative aspect came out of, so some young people had multiple workers, which meant that they had to repeatedly explain their experience or even relive their trauma with different workers. So that was one of the critiques the young people told us. And I'm also again gonna read the middle quote here. So talking about her worker, this young lady said that I saw her as someone I look forward to go and see. Yeah, good relationship, honestly. She was so sound. She knows how to understand, really. She's not just some old lady. She actually understands. She knows how to joke as well. She won't just sit there and be all bland. It's not all just work. She keeps things casual. So yeah, and then next slide, please, Holly.
So one of the most encouraging things we heard was that 86% of the young people said their experience with the out-of-court disposal had helped stop them getting involved in further crime. For many, it was a turning point, a chance to change direction without being labelled by a criminal record. They spoke about improvements to their mental health, education, and relationships, all of which helped them move forwards in a positive way. And reading one of the quotes here, they say, "I think it's definitely made me think twice about getting involved in any more crime. I don't want to go through that again." Next slide. So when we asked the young people what they'd improve about the process, a few clear themes came through. They wanted more consistency, ideally the same work at every time, because building trust takes time and repetition. They also said it's important to have age-appropriate and neurodivergent friendly resources so everyone can engage in a way that works for them. And finally, they wanted the option of continued support even after their out-of-court disposal had ended. See, many of the young people we spoke to had received a second or even a third out-of-court disposal because once their initial support had ended, there was nothing in place to help them stay on track. So ongoing support could prevent that cycle, giving the young people the stability and guidance they need to move forwards and avoid reoffending. Next slide, please.
Oh, I think we missed one slide. Well, anyway, thanks, Alex. Yeah, that's one slide. Which anyway, was our last slide. We just want to say what our message is today and every day, that for systemic change, you have to include the voices of young people and children because they know what it's like and they know how to make it better. And also that if anyone here is interested, including the insights of people with lived experience in their work on their projects, or if you just want to find out more about what User Voice does, please get in touch. I had an email there in the last slide, but it's not there now. But I'm sure you can find me online or any of my colleagues. So, but yeah, that's it from us. Thank you. And now I'm going to pass over to Helen, who is going to talk about the out-of-court disposal effective practice guide.
Thanks, Jenny. Yeah, thank you. My name's Helena Moore, and I'm the Effective Practice Lead within the Inspectorate. So we did publish an Effective Practice Guide alongside the report. And if any of you haven't seen any of the guides before, this slide is just giving you a bit of a flavour of what you can expect. So the guides are kind of designed to be a bit of a toolkit. So it's lovely if you want to read them from cover to cover and go through all of the examples. But if you just want to dip in and out of different subjects or any particular things of interest, there is hyperlinks within all of the contents to allow you to do that. So you can use it as a bit of a, like I say, like a toolkit. So within this guide, this is just some bits that we have included. We've got lots of examples around partnerships and services, particularly around the interventions that we saw while we were on the inspections. And also there's those really good case examples that we saw as well that really kind of bring where we saw our standards being delivered well, really to life. So you can really get into those case studies in those sections. Next slide, please. Also within the guide, if you see those little images there on the slide, we do include things like research and signposting just to really provide the evidence base for the examples that we've shared, and also anything that we thought might be useful for practitioners and leaders in terms of the work that you're doing. So those links will take you outside of the guide, and it's always quite interesting and helpful to see those pieces of work. But also we've included some videos that either we've recorded or again were external recordings which we thought would be helpful. We also include reflection questions throughout the guide. So the Effective Practice Guides are really good tools in terms of maybe training that you're developing, or if you're having team meetings or discussions around this subject. So what we've done, we've sprinkled some reflection questions throughout the guide, and at the end of kind of sections, which would really help you kind of start those conversations, reflect on some of the information within the guide, and really kind of, again, bring things to life, and you can have those discussions amongst yourselves. Next slide, please. So yeah, so there's absolutely loads of examples. So I've had to pick a few to just share with you today. In terms of partnerships and services, there's a couple of police examples here. Now, Dorset Police was highlighted because of its structured approach to considering and assessing the suitability of delivering the out-of-court disposals. So it speaks to some of the things Ian mentioned earlier that maybe were lacking in some of the inspection findings. But within Dorset, what we found was that they were really focused on that joint decision making and safeguarding and victim engagement. And also they had a dedicated sergeant that reviewed all community resolutions before any were issued. Every single case was also assessed for its offence severity, their history, welfare, all of those things. And the child gravity matrix was used before decisions were made, which again, has been mentioned, wasn't always the case. And for those repeat offences or serious offences, they were always referred to the Youth Justice Service for assessment through that joint decision-making panel process. All decisions were logged on the C413 form, so they also included any victim impact information or restorative justice details, so really kind of strengthening that transparency and accountability. In Wigan, we heard about the Prevention, Prosecution, Intervention, Education and Diversion Panel, so PPIDE. And again, this was an initiative that was joint worked with the police, and that was around identifying children that may be at risk of entering the criminal justice system and having that preventative response rather than reactive. So agencies would meet weekly and they would share information and they would tailor their support, and they really targeted children that were aged 14 to 17-year-old and they would come into repeated police attention, but there was no services involved. So they were able to access things like mentoring or services through turnaround or, you know, local area services to provide that holistic support. But also, if a child went on to then get an out of court disposal, any of the professionals that they'd been working with would continue to work with that child, so would, you know, offer that consistency and also that familiarity in terms of who they've been engaging with. So they told us that over 300 children had been supported to date, and that had improved wellbeing and reduced reoffending. And also the model was being evaluated and considered for national rollout by the Home Office and MOJ. Next slide, please. So in terms of health, just a couple of examples. During the thematic, it was found that children who were coming into the YGS often had health needs, and research was showing that often the health needs were linked to why they were becoming involved in crime, but then due to the kind of short intervention timeframes or, you know, long waiting lists, they were exiting the Youth Justice Service without having those needs met. So in Wigan, we heard about the Positive Health Pathway Service. So again, that was aimed to address that gap. So they were offering health assessments, interventions and ongoing support, and also beyond justice timeframes as well. So if an out-of-court disposal had ended, they would continue working with them. It was NHS funded and it was really integrated within the services such as police panels and reach panels and children's social care. And they were supporting children aged 10 to 18, regardless of what the outcome was and why they were involved. So they told us that they were receiving around 21 to 25 referrals a month, and they were able to really broker that support at other external kind of wider services such as CAMS, speech and language therapists and things like that. In Dorset, we saw speech and language therapists, so I'm aware that, you know, lots of services have these in place, but in Dorset, they'd had SALT since around 2018, but they'd been able to access additional funding, particularly for the out-of-court disposal group. And they were using lots of creative interventions that we see elsewhere as well, in terms of, you know, comic strips and, you know, the materials that they were using to really engage children. But again, the real strength of this particular area was they had this partnership with NHS, which was enabling really streamlined, seamless referrals into the wider services, and again, improving that continuity of care. We also heard about a re-engage programme that they've got in schools. So that's a preventative strategy they have in terms of engaging with children before they enter the youth justice services. And they were also training police officers and magistrates and volunteers in their communication skills with children. And we heard about other things that they were doing as well in terms of enhancing their out of court disposal screening for young children with weapon offences, for example. Next slide, please. So in terms of the intervention we saw, we did see some fantastic work, and they are all within the guide. But I just really wanted to spotlight Walsall in terms of what we'd seen in terms of being really creative and addressing particular needs. Now, they had lived experience mentors, and they'd commissioned a particular mentor to come and work with children from Black and minority ethnic backgrounds. And some of you will be aware of Ricky Otto's work and his lived experience and how he uses that to kind of target and promote that culturally responsive and identity affirming practice. And he was working with Black boys to explore their identity and their culture and masculinity and their experiences of discrimination. And if you want to read more about his work, he's also featured in our Children at Risk of Remand Effective Practice Guide as well. So there's some more examples there of that kind of targeted work that he does. We also heard about Open Lens Media. So they are an employability social enterprise, and they were working with children and adults, in fact, aged 11 to 35 from low socio-economic backgrounds. So they were able to access that, that package of support around CVs and interviewing skills, but also kind of mapping their skills and career planning and all sorts of things that would support them in moving into education and employment. And then also we saw Empower, which was a mixed martial arts approach to an intervention for those young people and children who maybe couldn't engage as well with traditional interventions that were available. So through physical activity, they were focusing on confidence and stress relief and positive mindset, but also they were, through those weekly sessions, they were having structured conversations during the activities as well, which was really kind of, again, focusing on people's resilience and life choices and mindset as well. So that was a really targeted intervention for maybe children with maybe neurodiverse needs, for example. Next slide, please. And then finally, the work with victims. Again, there's some more examples in the guide, but just to highlight the group with no name. So this was a group that was formed acknowledging that those children on out-of-court disposals are sometimes also victims of crime. So they used the Lundy model to kind of establish what it is that the children needed to feel safe and, secure in this environment. And what they said was they wanted that space. They talked about particular locations, and they wanted to be able to talk openly and, feel as though they were reconnecting with the community and building friendships. So there was restorative justice practitioners that were there supporting the group, and they did work around trauma-informed practice and relational activities and things like that. But what was really lovely about this group is that they were invited to the Restorative Justice Council to share their experiences, and this was part of a continuous professional development event. And every child that engaged with that, I think there was 8 children in total, all were given an AQA certificate. So they took away something really tangible and something to be proud of in terms of, being part of that kind of experience and sharing that with wider agencies. So yeah, so like I've said, lots and lots more I could have talked about today, but I'm really conscious of time. So I just would thank you for listening, and please encourage you to go and have a look at the Effective Practice Guide. But for now, I'll hand you back to Martin. Thank you.
Thank you very much indeed, Helen, for that presentation, and thank you to all the presenters that have brought us in very, very close to time. I think it was a really excellent overview of the findings in the report. And I would certainly give a plug for the Effective Practice Guide and the work of User Voice. Certainly excellent people to use out there, so do have a look at those. We've now got about 25 minutes for Q&A. I know from having a look that there's a healthy number of questions already in the Q&A function. And again, if you've got any further questions, do put them in there. Holly, you are the hostess with the mostest today, who is helping us with this. Do you want to pick out some questions and then we'll field it within the panel and we'll get through as many as we can in the time that we've got available?
Yeah, so what I'll do, first of all, I'm just going to go to the very first question that we were asked, and that was from Mark Crisp, and he asked, do you have any thoughts regarding the usage of outcome 20? There should be very few genuine occasions where joint decision panels should ever make decisions relating to this, as the investigation has already ceased. Locally, we rarely use it, yet others seem to have significant numbers. So wondering if this was represented in your report/discussions.
Yeah, well, I know immediately who I'm going to go to on this question. I'll go to Ian and Michelle for any comments on this. I don't know who wants to come in first.
I'll let Ian come in first, Martin, with the detailed knowledge.
Thanks, Michelle.
Yeah, it's a very hard one because as I said earlier in my presentation, it's very actually hard to understand at the moment what anyone means by outcome 22 for a start, and which part of the outcome 22 pot we're talking about. So I think I probably need a bit more information before I can kind of give a definitive answer.
I don't know if the person asked the question because maybe come off mute and sort of feed in and maybe talk to it a bit more.
Yeah, I'm happy to. That's not a problem. Hopefully you can hear me okay. I'm
can hear you
listening
perfectly.
on my apologies. I'm probably going to be quite broken up and quite delayed. Yeah, this is specifically around outcome 20. So there's significant numbers that are used across the board nationally, and you've already highlighted there's a postcode lottery here in relation to its deployment. 22 is a completely separate matter, but 20 is really clear that is effectively an outcome whereby there is an investigation that's being owned by another agency outside of the police, where we hold them on that code temporarily, and we close them off. So by the time they've reached a panel, we're already at that decision point. So we shouldn't be dealing with them as outcome 20. It shouldn't be on the table because the investigation's still ongoing. And it's just wondering whether or not that came out in the report.
The short answer to that's no. Not really. I mean, there is definitely variation between what forces do with outcome 20. This is a very personal view here, but actually it's more than appropriate, of course, to close crimes with outcome 20 where there are interventions being delivered by another agency. But my personal view about it is that actually the police, I think you alluded to it there, they should be adopting the outcome 22 guidance in as much as the police should make sure that the interventions are delivered by the agency before they use that outcome code. Because I think what we saw was, and I think you alluded to it, is that outcome 20 is attributed straight away and the crime's closed, and no one's actually sure whether the other agency has picked up the case and looked after the child and delivered the interventions. So I think there is scope for the Home Office to review, and in fact I have spoken to them about it. I think there's scope for the Home Office to give more guidance to police forces about when they use outcome 20 and when they do it, they should actually make sure they kind of adopt the outcome 22 guidance. So sorry, I mistook the question at the start. Michelle, I don't know if you want to add anything to that.
No, I mean, I echo what you're saying, and I think the other thing about the other agency, there was some inappropriate stuff being referred to other agencies as well. That's what we did see in the report, didn't we? So offences were being pushed back to other organisations, which actually should have perhaps been dealt with by policing, really.
I think just the last point on that, so there's loads of questions, is a large number of the outcome 20s are offences which have taken place in school, and the agency that has been is relevant to the outcome 20 is actually the school. So it's just an observation that there's no right or wrong answer to that, but that's just an observation that lots of those crimes were being reported by the school, dealt with by the school, and as far as the police were concerned, that was satisfactory, and that's why they closed it.
Really helpful. Thank you very much, Ian. I think it's a really good question. Holly, where are you going to take us next?
So I was going to take you to a question from Mark Powell, which was, what was your findings about information sharing during the provision of support? Our experience is that it is much stronger at the beginning, at the assessment and planning stage, and then inconsistent thereafter. It relies on the Youth Justice Service asking for information rather than having it shared routinely.
Good pick of question, Holly, because it enables us to go. I'll go to Maria first on this one and then to the wider team. Maria.
Thanks, Martin. That's a really good question, actually. In some cases, it was strong at the assessment and planning stage, and in some cases, it wasn't actually as strong as we would have hoped to have seen it there. There wasn't always a full understanding of the picture of the child. So there was gaps in terms of, as we covered in the presentation, from the education provider, who could really give such a lot of insight and understanding and contextualised behaviour. There were children that had received previous out-of-court disposals, both on the spot, as we were calling them, from the police without intervention with the Youth Justice Services, and that wasn't fully known about. Before we started our inspection, we got information on each of the children whose cases we were going to look at to find out their previous contact with services. And we found in our inspection that contact with children's social care, for example, wasn't always referenced in the assessment. So this meant that the planning and the intervention delivery wasn't linking in appropriately to the services, both to find out the information and to draw on their knowledge and interventions as well. And a lot of that, in many ways, seemed to be there was a challenge, I think, for practitioners around how far should they go, given that this is an out-of-court disposal, and it's going to be quite a short term. It's going to be a short intervention. Where should they focus, and how much depth should they go into? I think was sometimes a driver in that. We did also, I have to add, see excellent examples of cases where information was shared effectively, and it was shared ongoing with agencies as well, to ensure that there was a good exit plan in place and effective follow-up and support for the child. So we saw examples of both, but information sharing was a challenge.
Thanks very much, Maria. I didn't know whether Laura or John had any other observations from having obviously seen some of the cases as well.
Really add anything to what Maria's just said there, to be perfectly honest. No, sorry, Martin.
That's right. Perfect. Holly, do you want to take us to another question?
Yeah, so Stephen Wood has got his hand up, so I'm going to invite them to ask their question.
Hello, Stephen.
Hi, Martin and team. Thanks very much for today. That's been great, and it's more of a statement than anything. But can I go back and just address one of the questions that was asked earlier, Martin?
Yes, of course you can.
That's okay. And that was around the use of outcome 20 and 21. We found it very useful for children in care, residential care, where the residential provider requires a crime number to make, say, a claim against insurance if there's been damage to a car or a building. But they're actually taking care of the kid, and the kid has a full package of support in place. And it's much better to dispose of the case that way than with a 22 or an 8 or any other measure. And you have so that was just some input there. And it's a little bit of it was really pleasing to hear throughout that your findings match what has been reported by youth justice managers across England and Wales at the moment around this work. And there's that inconsistency of understanding of informal and formal out-of-court disposals, the inconsistency of approach in practice. This is a very timely thematic inspection for us as we're trying to pull it together in the absence of absence of national strategy. And one of the biggest prohibiting factors that we've got at the moment is the status of informal out-of-court disposals in different police forces, whether it's seen as negative or positive or not positive outcome, is a real prohibiting factor for us at the moment in making a case for it. And when we're thinking about making a case, I think we need to do more as a youth justice system, making the case for the positive outcomes of the out-of-court outcomes. So your recommendations around getting reoffending rates put in there around out-of-court disposals and getting rid of FTE reporting is really, really positive for us, because FTEs are becoming a little bit divisive. It seems like we're chasing a target rather than a performance. And that's what it can be seen as. We're just trying to lower FTE figures. So those two things. But and thanks to Helen for that really useful guidance document that's been created. I think that helps with the consistency stuff for us in youth justice. But overall, we need a national strategy, Martin. But we've even got it at the moment within Wales, where we're going to have a policy document in North Wales for North Wales Police, and we're going to have one for Gwent Police, and we're going to have one for South. We're going to have South Wales Police and one for Dyfed and Powys. And although we're trying very hard to pull it together, we can't do it outside an umbrella of a national strategy. And that strategy needs to help us with, it instructs where it's needed. It contains principles about why we do it. And that goes back to my point about making the case for the positives for victims, the public, community, and the child around engaging early and getting better reoffending rates. And guidance on process and practice, because we could have all the will in the world and all the laws will still drift when it comes to local practice. So we need that. And the last thing I would mention is terminology. I think we need to be focused on keeping it basic, informal and formal out of court disposals. Call them what they are to begin with. Outcome 21, outcome 20, outcome 8. And then locally, if you want to get colloquial, but get your brand first before you brand it. So that's me. I'll shut up now. There's no questions here. Sorry.
No, thank you, Stephen. I've got to say, a huge amount of useful stuff in there and some really useful feedback for us. Really valuable to hear your voice, as it always is. So good to see you again. Thank you. Holly, I know we've got a few more questions we can go through. We've got about 10 minutes left.
So this question from T Rumble. The findings and recommendations are considerate of child first approaches. How can the police services implement out court disposals fairly to people on the brink of turning 18 versus having just turned 18? The defined age bracket makes it extremely difficult. For example, with a group of 17 and 18-year-old people stopped. Are we suggesting the under 18 should be treated differently in terms of the outcome of the incident? How is this age bracket considered and recommendations and approaches?
Gosh, that's a big question, isn't it? I'm going to look to colleagues in Ian and Michelle for a thought on this one, maybe.
Oh, it's a big question, isn't it, Ian? Have you got a thought in terms, because that's always the issue, isn't it? That transition between sort of child and adult right across, not just in this area, in lots of areas. But Ian, have you got a view on what we've seen in terms of what we've seen in those forces?
No, I don't actually, because we were tightly focused on our evidence base is all about children under 18, so I just couldn't take a view on anyone who is over 18. What I do know is it is difficult, because you end up with a different set of out of court disposal options for someone who's 18 and someone who's 17 years and 364 days old. And I think that's really hard to get to grips of. So
I think it comes back to that transition piece, Martin, doesn't it? Which we see right across, going from sort of the children's end into adults, and actually how do we, especially those individual, those children that we've had a lot of contact with, how do we transition between the two sets of services from children to adults?
I completely agree with that assessment. I guess my other thought, particularly, we've got Maria here, who led my thematic inspection on young adults, actually, and there is a huge read across to the fact that, of course, as we all know, that somebody doesn't turn 18 and suddenly become a fully formed adult without the vulnerabilities and the issues that they face before that. And I think probably the way that, unfortunately, the way the law works, of course, is you get to a certain point and legally you're in a particular bracket, but of course in reality a lot of that carries over. I think there is some stuff around sort of transitioning which I think is really important. Maria, obviously you did all that work for us last year on young adults. Any reflections from you on dealing with young adults?
Well, not in relation to this, really, Martin. I think it's a challenge, isn't it? One day you'll be dealt with it's in this child-centered way, and then the next day it's completely it can be very different. So yeah, I mean, as Ian said, we were focused only on children here, but in terms of the themes with the young adults thematic, what we did know then is there's a cliff edge across all aspects of support for children and opportunities as well. So it is something that needs to be considered in the round, I think, around that transition piece, like Michelle said.
Perfect, Maria. I'm really grateful for that insight from you. Holly, we've probably now got about 7 or 8 minutes left, probably come for another 2 or 3 questions, hopefully.
Yeah, so we have got quite a few questions, but I am just going to invite Kim, if they would wish to ask a question, because I can see that they've got their hand up.
Lovely. I like a raised hand.
Thank you. I'll be really quick. I'm one of the managers in Newport Youth Justice Service, which is a very violent city. But we have complete buy-in from the police, and we work really, really well. And a lot of the things you were saying about, I'm pleased, like Stephen Wood, who's a colleague of mine, to say that we're doing a lot of those things and we've got that buy-in. The only thing we haven't got in place is deferred prosecutions and deferred cautions, using them at the moment. And obviously that's a police thing. My question is, what would be, how is this going to be? I think it's for Ian, if anything, but how would this then come back to the police? Because I know we're in Wales, but we know in England some of forces are using these. But if they could use them in Wales, it would really help us. Is that on the cards, or is that likely, Ian, do you think?
I think our recommendations are pretty clear about the fact that we would like to see proper deferred cautions and prosecution schemes. We're strong advocates of that. Our issue at the moment is there's no national guidance about either of those. And I think that the Home Office and the MOJ have to work closely with the police by the MPCC to actually set some ground rules for areas, so that areas can understand exactly what that means, what they've got to tell the child, what does the child have to sign up to, what happens if the child doesn't complete the interventions, what's the involvement of the CPS if you're talking about deferred prosecution schemes, because at the end of the day, if it's deferred prosecution, it should mean what it says on the tin. And if the interventions aren't completed, then there should be a prosecution, or at least a consideration of a prosecution. So I think the short answer is we're strong advocates of it, but at the moment there's just nothing out there for, like you said, for areas, and it is a structural issue, which is why we've made structural recommendations about it.
Thank you. Yeah, it's just in Newport that I feel like the children would have something to aim for, as opposed to getting the outcome first and then, if I don't do it, something's going to happen. But to actually show them that if you work to something, there's an outcome that is for your benefit. Yeah, thank you, Ian. Thank you.
Great question, Kim. And just to let people know how this works, we publish a thematic inspection, we make recommendations, but we do follow up with those who are making recommendations too. So I'm sure there will be ongoing discussions with the Home Office and the MOJ, but particularly around what Ian has just spoken about, because it's really important that we get a greater level of consistency, but also that we provide people with the support they need to use it properly and appropriately as well. So I think it's a really excellent question. Holly, next question.
So I'm just going to ask this question here. So this is from Amy Bruce, and they have said, this has been great to hear. You mentioned the inconsistency of the application of the matrix and decision making, and I'm curious if there were any links to seniority of the decision making panel members. If so, bearing this in mind, what seniority is expected when making these decisions, both within the police and youth justice system or service, might I ask?
Wow, that's another good one.
I'm picking typical ones today.
Excellent questions. So probably I'll go to Maria and Ian on this, given the fact that it was decision making in the Youth Justice Service and also within the police. Do you want to go first, Maria?
Well, I'll let Ian start, actually.
Okay.
If that's all right.
Poor Ian. Back to Ian again.
Yeah, so Maria will have a lot to say about the panels, because that was something she specifically looked at, particularly the makeup. So although I did the slide, it was Maria who did that kind of bit of field work. But in view of this, my opinion about the seniority from the police side is I actually think it should be a sergeant, and you'll know that in the effective practice guide, which Helen talked about, in Dorset, it was a sergeant making a decision who was able to filter some of those cases and then work jointly. I think it should be a sergeant. I think it's hard for a constable to make a decision. When you've got a youth justice service manager, I think there might be an imbalance there sometimes, certainly in some of the panels. And that's why the reason I'm saying it's a sergeant is because you'll know that if you've read the report, that one of the recommendations is around escalation to senior police officers. And the escalation point that we've advocated for is for an inspector. So it makes sense for the original decision to be a sergeant, and then for it to be escalated to an inspector if there can't be an agreement, or if there's a wide variation in the gravity matrix. So I think that's pretty clear. I think it should be, my personal view is I think it should be a sergeant.
Yeah, and just to follow on from that, I agree with what Ian said about that. And in the panels, joint decision making panels, there was examples where it's police officer, and there is a dynamic there as well, because obviously, you know, it's there's a mismatch between the level of authority of the youth justice manager that's chairing the meeting, and sometimes in some youth justice services there can be line management responsibilities and things as well, which can just add complexity to the dynamic. So yeah, for the same reasons, for those reasons, I agree with what Ian said.
Fantastic. I think the questions have been perfect. They've allowed us to cover a huge range of issues very quickly that were sort of nuanced within the report itself. One last question, and then I'll close proceedings.
Okay. I'm just going to go for the most recent question that was asked, which, I've already answered one of Mark Powell, so I'm not going to answer him. That's enough. Just because to get everyone to get a fair spread. So this was Thomas Cullen. So following the point re-language and child first approaches, has there been any consideration to changing the language to that of out of court resolutions rather than disposals in accordance to the recent launch by the YEF of their digital tool to support effective out of court resolution practice?
Wow. Okay. Maria, Ian, any thoughts on that?
I can help with that, Martin. I think from what I've seen that Catherine Roper, who's the NPC lead for child-centred policing, is considering whether or not she needs to make an announcement that actually all out-of-court disposals, as they currently are returned out-of-court resolution. So I think there is something in play as far as that's concerned. I think it would be really helpful if that happens.
What a perfect way to conclude that, with a really positive that we'll get a further change coming down the line potentially, which would be helpful and supportive. So thank you very much indeed. I'm extremely grateful to everybody for dialing in today. This event is going to be on YouTube, I think, later today. I'm hugely grateful for the questions and the panelists, but thank you very much, everybody. Do read the report in the detail and look at the effective practice guides and the Univoice report. But I look forward to speaking to you at one of these events in the future. But thank you very much, everybody.
Thank you.
Thank you. Bye-bye.
Thank you.
Bye.
Thank you.
Yeah, thank you.